Hello, everybody. I am so sorry we were experiencing some technical difficulties. I hope everyone can see the presentation and hear me. If not, please write in the chat. But welcome, everyone, to our October webinar on Embracing the Seasons, Thriving Despite Seasonal Affective Disorder. This is also commonly known as SAD. For many, the colder months can bring more than just a chill. They can affect our mood, energy, and overall well-being. But here's the good news. There are many effective ways to manage it and even thrive during this time of year. We'll explore what SAD is, how it can impact your daily life, and most importantly, practical tips you can start using today to feel better and stay energized. So what exactly is seasonal affective disorder? SAD is a form of depression that is triggered by the changing seasons. Most often, it starts in the fall and continues in the winter. Although some people can experience it during other seasonal shifts in spring or summer. And to reiterate, SAD is not a standalone condition, but rather a type of reoccurring major depression with a seasonal pattern. According to the Diagnostic and Statistical Manual of Mental Disorders, for depression to be considered seasonal, it must begin and end during the same season each year, last for at least 2 consecutive years, and occur more often in specific seasons than during other times. It's also more common than you think, affecting around 5% of adults in the United States. Symptoms can last for about 40% of the year. It's a long-lasting, serious condition for many. The silver lining, it typically fades away as spring arrives, and there are plenty of strategies to help manage it. So before we get that far ahead, you could be wondering how this form of depression can just come and go by the seasons and what SAD is characterized by. You might be thinking, isn't this just the winter blues? Well, not quite. While both can make you feel down in the colder months, SAD is more serious and lasts longer. The winter blues are more like a temporary dip in your mood, but they don't interfere with your daily life in the same way that SAD does. With SAD, you're dealing with significant depression that affects your ability to work, socialize, and enjoy life. So if you're feeling down and it's impacting your daily routine for weeks or months at a time, it could be more than just the winter blues. So one of the key players in this condition is serotonin, a neurotransmitter that significantly influences our mood. When sunlight enters our eyes, it stimulates the part of your retina that then cue the brain to produce serotonin. Due to the shorter days and longer nights, there is reduced sunlight during the fall and winter months. This can, in turn, lead to lower levels of serotonin, which has been linked to feelings of depression. Additionally, studies have revealed that individuals experiencing seasonal changes in the fall-winter months tend to have a higher levels of serotonin transporter protein that removes serotonin from the brain compared to those who don't experience these seasonal changes. This means less serotonin is available to help balance mood, contributing to those feelings of sadness and lethargy. And another important hormone related to SAD is melatonin. This sleep-related hormone that's produced by our pineal gland in the brain, and its production increases in response to darkness. Awesome. Thank you for the comments of those that can hear me. Um, I paused a little bit. If you can give a thumbs up in the chat, that would be greatly appreciated. So sorry for all the technical difficulties for this webinar. But let's go back to this sleep-related hormone, melatonin. So when the days get shorter and darker in the winter, melatonin levels rise, which disrupts our sleep patterns and impact our mood. And this overproduction of melatonin can throw off our circadian rhythms, that internal body clocks that you've probably heard of. And circadian rhythms are synchronized to respond to daily light and dark cycles. However, people with SAD, the signals indicating seasonal changes in daylight may not align properly, making it harder for their bodies to adjust. Lastly, with less outdoor exposure to sunlight in winter, individuals with SAD may produce less vitamin D. This fat-soluble vitamin is believed to play a role in serotonin activity, and deficiencies in vitamin D have been associated with significant depressive symptoms. All in all, the interplay of serotonin, melatonin, and diminished sunlight is what leads to those symptoms of SAD. So let's talk about the risk factors that can increase the risk of developing SAD. One, family history plays a role. If you have close relatives with depression or other mood disorders, you're more likely to experience SAD. Geography also matters. People who live farther from the equator, where there's less daylight in the winter, are at higher risk. The further north or south you live, the greater the likelihood you'll be impacted by SAD. Women are also more likely than men to be diagnosed with SAD, though the severity can be greater for men who do experience it. Young adults are also more affected, with symptoms often starting in the late teens or early 20s. And if you've struggled with depression or bipolar disorder before, you're more vulnerable to those seasonal patterns of mood changes. And again, those low levels of vitamin D, which is produced by sunlight exposure, can contribute to the onset of SAD. So the symptoms of SAD can vary depending on whether someone experiences the winter or summer seasonal pattern. For the winter seasonal pattern, people often report feeling a persistent sad mood. This isn't just a fleeting feeling, it can be a heavy sadness that makes it hard to enjoy everyday activities. Along with this, irritability may increase, and some may find themselves crying more often than usual. Our energy levels also take a hit. Many individuals with winter SAD feel tired and lethargic, making it challenging to get through the day. It's common for those affected to sleep more than normal, a condition known as hypersomnia. And this excessive sleep can make them feel even more sluggish and withdrawn, leading to the reduced social interactions. Concentration can become a struggle as well, and people may notice that they have difficulty focusing, which can affect the work and daily tasks. Additionally, many people crave carbohydrates. Now, when we're talking about carbohydrates, we're talking about like breads, pasta, things like that. And also sugars during the winter months, which can lead to weight gain from overeating. And it's our body's way of seeking comfort, but it can create that cycle that is really hard to break. On the other hand, summer seasonal pattern brings its own set of symptoms. While irritability is still present, individuals might experience a poor appetite, leading to weight loss. Insomnia and restlessness are also common, making it tough to get a good night's sleep. And people with summer SAD may feel anxious or agitated, and in some severe cases, this could exhibit episodes of violent behavior. And this just highlights the importance of recognizing the range of symptoms and getting help if needed. So overall, these symptoms are of how SAD can manifest in the body and our mind. So now let's talk about how SAD impacts our daily life. These symptoms don't just stay in the background, they can really disrupt how you function from day to day. At work or school, you may notice your productivity takes a nosedive. In fact, people with SAD often experience up to a 40% drop in their ability to focus and perform tasks. It's tough to stay motivated, and this can lead to falling behind or missing deadlines. SAD can also strain relationships. You might feel more irritable or withdrawn, which makes it harder to connect with friends and family. Conflicts may arise more frequently, or you might start avoiding social interactions altogether. And this isolation can make things even worse. Hobbies and activities that once brought joy, whether it's exercising, reading, or spending time with friends, may start to feel like a chore or something you just don't have the energy for anymore. Physically, that lack of energy, increased sleep, and weight changes can make it feel like your entire body is in slow motion, which affects both your mental and your physical health. And this disruption can feel like a long pause button is pressed on your life during these colder months. So now that we've talked about how SAD can disrupt different areas of our daily life, symptoms, how it's different from the winter blues, we're now going to start talking about how to take care of yourself if you have SAD. And there's going to be many that we talk about and you can implement into your daily life. So it's normal to have some days when you feel down. But if you feel down for days at a time and you can't get motivated to do activities you normally enjoy, and that you may have seasonal affective disorder, see your healthcare provider. This is especially important if your sleep patterns and your appetite has changed. If you turn to alcohol for comfort or relaxation, or you feel hopelessness or think about suicide. Doctors typically diagnose SAD by looking at whether your symptoms follow a seasonal pattern. If you consistently feel worse during the fall and winter, but notice improvement once spring comes, and that's a key indicator. And it is worth reiterating that SAD is more than just feeling a little down during the colder months. It is a form of major depression, and recognizing it early on allows for more effective treatment. And if it's left untreated, the symptoms can worsen over time. So seeking help sooner rather than later can make a big difference. A healthcare provider can assess your symptoms, rule out other conditions, and guide you towards the best treatment plan. And once diagnosed with SAD, there are several treatment options as well. One of the most common and effective treatments is something we'll explore next. So one of the most effective treatments for SAD is light therapy. And this involves sitting near a special light box, which is designed to mimic natural sunlight for about 20 to 30 minutes to an hour each morning. The goal is to make up for the sunlight that's missing during the darker winter months. And light therapy works by reducing melatonin, the hormone that makes you sleepy, and boosting serotonin, which helps improve mood. And there are various light box designs available, from desk lamps to wall-mounted fixtures, all producing a bright light. And the intensity is measured in lux, and the higher the lux, the brighter the light. And there's also another option, sunrise alarm clocks, which slowly brighten your room in the morning to stimulate a natural wake up. For most people, light therapy is safe, and the recommended light boxes have filters to block out those harmful UV rays, so there's no risk to your skin or eyes. However, if you do have an eye condition or are taking medication that makes you sensitive to light, like some antibiotics or antipsychotics, it's important to talk to your doctor first. So before starting, check the manufacturer's information to make sure the light box is medically approved for SAD treatment, and be sure it's the correct light intensity and use recommendations. And of course, always consult your doctor to make sure light therapy is the right approach for you. I'm now going to pass this on to Emma.
Thank you, Lexi. So while light therapy works well for many people, it's not the only treatment. So another effective treatment for SAD is cognitive behavioral therapy, or CBT. This is a type of psychotherapy that focuses on identifying and changing those negative thought patterns that contribute to depression. So for SAD specifically, CBT has been adapted into a specialized form called CBT SAD, or CBT SAD. So this technique uses the core techniques of traditional CBT, like challenging those negative thoughts, replacing them with more positive ones, but it also includes a technique called behavioral activation, which encourages you to engage in activities that are both enjoyable and rewarding, whether they be indoors or outdoors. So this helps you stay active and connected during the months where you might otherwise feel more isolated or unmotivated. And the goal of behavioral activation is to break the cycle of low energy and withdrawal that can come from SAD by helping you rediscover hobbies, social interactions, or even simple tasks that bring a sense of accomplishment. So CBT SAD can be done on its own or combined with other treatments like light therapy. And for many, this combination provides the most effective relief from symptoms. Now, we've been talking a lot about light. One of the simplest yet most effective strategies to support yourself if you have SAD is to maximize your exposure up to natural light. So even on shorter winter days, seizing those opportunities to step outside when and if the sun is shining, whether it's a brisk morning walk or just relaxing by the window with a warm drink, soaking in sunlight can significantly uplift your spirits. So inside your home, make it a point to keep your curtains open during those daylight hours to allow as much natural light in as possible to brighten your space. And like we said, even short 5-minute walks outside during your lunch break can have a remarkable impact on your mood. And when it comes to boosting your mood, physical activity, as we know, also plays a huge role. Exercise is known to release endorphins, those feel good hormones that can elevate your mood. So just 25, 10, 20 minutes of walking can help reduce stress levels significantly. If the winter chill keeps you indoors, don't worry because there's also plenty of indoor options available like yoga, dancing, simple home workouts that can keep you moving and energized. The essential thing is to incorporate movement into your daily routine, as staying active is vital for fighting off the sluggishness and low mood that we associate with SAD. So it's all about finding something that works for you, finding something that you enjoy. Your living environment can also significantly influence your mood, especially during those colder months when we're spending so much time inside. So, by creating a cozy and inviting space at home, you can greatly improve how you feel. So, thinking of things like warm lighting, soft blankets, comfortable seating arrangements that encourage relaxation. You can also consider establishing a designated area in your home where you can unwind, whether it's curling up with a good book or just listening to some calming music. You can also consider things like adding calming scents like lavender or vanilla. These can also enhance your space's atmosphere and foster that sense of peace and comfort. We know that isolation can exacerbate symptoms of SAD, making it all the more tempting to withdraw during those cold, dark months. However, maintaining connections with friends and family is incredibly important for your mental health. So you can reach out through quick phone calls or set up virtual coffee catch-ups or in-person coffee catch-ups to stay engaged. Uh, you can also consider incorporating seasonal sports into your social activities, even if you're not familiar with the games. You don't need to be an expert, but just simply showing interest and learning alongside others can create connections and enhance your social engagement. You can also try scheduling regular social activities, putting it in the calendar, even if they're small. So things like weekly dinners or other places to routinely meet with family or friends. These interactions can have a huge impact on your mood and help you through the loneliness that can sometimes accompany SAD. And then lastly, just remember even brief moments of connection with others can uplift your spirits and provide much needed support. All right, a little bit on nutrition. So, what you eat and how you sleep are both greatly influential to managing symptoms of SAD. So, from a nutrition perspective, incorporating omega-3 fatty acids found in fish like salmon and also in nuts can help enhance your mood. Also, making sure you're getting enough vitamin D, especially during the winter months when sunlight is limited. You can find vitamin D in fortified foods or supplements if needed. And as always, talk to your healthcare provider before beginning any supplement regimen. Um, on the whole, we want to focus on eating a balanced diet rich in whole grains, fruits, vegetables to keep our energy levels steady throughout the day. So while sugary snacks and refined carbs might give us that quick burst of energy, they can also lead to crashes later on, which can make you feel more sluggish and irritable. So prioritizing nutritious foods will help support both your physical and mental well-being. Then if you're interested, you can always consult with a dietitian or a physician on what kinds of things you should target in your diet or what you should increase. Now, when it comes to sleep, one of the key factors in managing SAD is maintaining a consistent sleep schedule. So trying to go to bed and wake up at the same time each day to regulate your internal clock, even if it is tempting to sleep in during those darker mornings. We want to be mindful of oversleeping, right? Our comfortable environment makes it very easy to oversleep, but that can make us feel more fatigued. So practicing relaxation techniques like deep breathing or progressive muscle relaxation before bed can help us wind down and improve the quality of our sleep. These good sleep habits will leave us feeling more refreshed, more energized to handle the day, which is critical during the winter months when those SAD symptoms can peak. Overall, prioritizing balanced nutrition and quality sleep can help keep our energy levels up and our mood stable and improve the quality of life no matter the season. So a little bit more on vitamin D. As previously described, during the winter months, many people experience a drop in vitamin D levels, especially in regions that have limited sunlight. This deficiency can impact both physical and mental health. So if you suspect your vitamin D levels are low, it's wise to consult your doctor about a simple blood test to check. While some studies suggest that vitamin D supplementation can help improve mood and reduce symptoms of depression, the research on its effectiveness for seasonal affective disorder specifically is mixed. So some individuals report benefits similar to light therapy, but others may not experience the same results. So it's important to view vitamin D as part of a more comprehensive strategy for managing SAD. Vitamin D alone is not a cure for SAD, but it can be one piece of the puzzle. Combining it with lifestyle adjustments like getting outside, maintaining a nutritious diet, staying active, using light therapy may provide better results. So again, before rushing out to buy supplements, make sure to consult your doctor. Vitamin D may not be suitable for everyone, and it's important not to self-prescribe just because it's winter. Your doctor can help determine whether vitamin D supplements are right for you and ensure you're taking them safely in conjunction with other treatments you may be using. So with all of that in mind, we're going to leave you with this reflection question, which is what's one thing that you can do today to bring more light into your daily routine? If you're somewhere where it's sunny today, that might be an easy answer, but just something to reflect on as we head into the darker months. And for more resources up on the screen, we have a guide where you can learn how to talk about mental health to help yourself, help your loved ones. That is the QR code furthest to the left. In the middle, there's more information on managing SAD from the Cleveland Clinic. And then to the right, the Mind info line offers different self-care ideas that can help manage SAD, again, during those colder winter months. And thank you very much for joining us today. We appreciate your patience with our technical difficulties, and we hope to see you next month for the November webinar, which is Resilience in the Season of Colds and Flu, all about developing and keeping healthy habits to boost your immune system. So once again, thank you for joining, and we look forward to seeing you next time.